Medicaid is really important. It provides free healthcare to more than 74 million Americans who wouldn't be able to otherwise afford it. But managing such a massive program can get messy. The original legislation, passed in 1965, allowed each state to create its own rules around eligibility and the scope of services it would provide. This led to a great deal of experimentation. Some approaches worked, some didn't. But even in states like Oregon, widely seen as a progressive leader in healthcare, the system always struggled with a few inherent problems.
There wasn't a lot of transparency in the funding and how money was being spent in our communities and on this population.
2008 brought the worst financial crisis since the Great Depression, and by 2011, the Oregon Health Plan was facing a $3 billion shortfall.
I think everybody knew we had to do something. Everybody knew the system wasn't sustainable as it was. We couldn't afford it, and that people weren't getting good care.
Oregon, like all other states, when we faced a budget crisis, we would either reduce enrollment, we would reduce payments to providers, or we would reduce the benefits. We had three levers, and I think at that time it was just the moment in time that said, we need to take a fourth path.
So when we started to think about coordinated care organizations, it was really based on a couple of things. One was that all healthcare is local, and that healthcare really revolved around the doctors and nurses and hospitals and patients that were all in a geographic area. And so the whole notion was, how do we get all those components of our healthcare system to work together rather than to compete with each other? And to create something that was cost-effective, that we could afford, and ultimately, the big issue was, how do we improve the health of our populations?
In 2011, HealthShare brought together everyone in the Portland metro region who was involved in providing Medicaid-based healthcare: doctors, insurers, hospitals, mental health professionals, you name it, and asked them all to collectively share the cost and responsibility.
I would say some of the early meetings with HealthShare in particular were difficult. This was the most complicated market because you've got fierce competitors with the hospital systems.
They had, you might say, a lot of baggage to get over at a personal CEO level, at an organizational level, historical level, and each one of them in turn sort of threatened to blow up the CCO at different points, but ultimately backed off because there was this sort of threat out there, which was Medicaid managed care as we know it is going to go away. So you can't just continue to do what you've always done because it's going away.
I think the biggest issue was, where's the money going? Who gets what rates? Will there be transparency? Will I know what's going on? What happens if I have the sickest patients, or if I have more patients, et cetera, et cetera. But those things were brought into the light of transparency, and those initial bones of contention really melted away.
The HealthShare model was designed to place an emphasis on caring for people before they were sick. Funds would be shifted to focus on preventative and early childhood care and unmet social needs that lead to health issues. The hope was that by keeping people healthy throughout their lives, the overall cost of medical care would be greatly reduced.
There were some who say, we don't need a health share because it's unnecessary overhead. We could have Kaiser, or we could have Providence, or we could have Tuolity or Care Oregon provide services. But the truth of the matter is, any one of those organizations unto themselves is not big enough to care for the population, nor do they have the complete breadth and depth of services necessary. And there is something to be gained from economies of scale and bringing the best from each of these organizations to bear and coordinated through HealthShare.
This is the single largest CCO in Oregon. Probably 25% of our population at least is in this one. If this one goes down, the whole system falls apart, so it's very, very critical. And I think it's just been a remarkable exercise of trust building and collaboration and cooperation and commitment to make this work and provide this care to a very vulnerable population.
In the 6 years since HealthShare was founded, the organization has made big strides in delivering on its vision of a healthy community for all. Developmental screenings for young children and assessments for children entering foster care have more than tripled. Unnecessary visits to the emergency room have dropped nearly 30%. And the CCO model has saved an estimated $2.2 billion in federal and state funds since its inception.
I think the ways in which we work together today versus in 2012-13 are immensely different. It's much deeper. We have different conversations in this community than we ever had before. People have relationships with people in other parts of the healthcare system that they didn't have before.